Retinopathy of Prematurity or ROP. Today I am going to talk about this condition. February 24th to March 2nd is the ROP Awareness Week, and as an ophthalmologist, I think that the would-be parents and grandparents should know about this. So I'm going to briefly discuss about retinopathy of prematurity. So what is retinopathy of prematurity or ROP? It is a condition that is present in some babies born a little early, too early, say before 31 weeks of pregnancy. And this, if not treated early, may lead to retinal detachment. So an early diagnosis and early initiation of treatment is necessary. You all must be knowing about Stevie Wonder, the gifted singer. We all loved his songs, especially his iconic song, I Just Called to Say I Love You. Well, he was a 34-weeker, and because in those days early diagnosis and treatment were not available, he had ROP, which ultimately led to retinal detachment, and he became blind. So retinopathy of prematurity must be diagnosed early to prevent this complication of retinal detachment, which leads to blindness. So now, who gets ROP? Number one, those who are born very early. Babies born at 28 weeks have a higher risk than those born at 32 weeks. Second, low birth weight. So around 1500 grams or less, these babies have more chances of getting ROP. Third, extra oxygen given after birth to help the baby breathe, which some premature babies need. So this is also a risk factor. Then fourth, the sicker the baby, more likely to have ROP. And of course, genetics has a role. So genetics may have a role in who gets ROP or who doesn't. Now, why do you get ROP? Normally, when a baby is born at full term, the retina is fully vascularized and the vessels are nice and flat. But if the baby is born earlier, the vascularization is not complete, and because of the various factors, abnormal vessels start growing towards the vitreous, where they may cause scarring and might pull the retina, causing a traction retinal detachment leading to blindness. How is ROP diagnosed? By dilating the pupils and examining the retina directly, the ophthalmologist will be able to find out if there are abnormal blood vessels growing inside the eye. The first examination should be at 31 weeks gestational age, but sometimes ROP might not be visible until several weeks after birth. The baby is examined again after 4 to 6 weeks, and if ROP is seen, the examination is done as per the ophthalmologist's assessment. The treatment. First, ROP can sometimes go away on its own as the baby grows, which is a wonderful thing. Second, laser. With laser treatment, the ophthalmologist uses a laser to burn away the edges of the retina. And third, anti-VEGF drugs like Avastin may have to be used. These drugs are injected, given as shots into the eye to stop unwanted blood vessel growth. So what is the prognosis? If prevention of retinal detachment is done by early screening and treatment is initiated early, then the chances of the baby having a good vision are ensured. So early screening, as I've emphasized all through this post, early screening, early detection and early initiation of treatment play a key role in prevention of retinal detachment.